Hello everyone. In this video we are going to learn the manual therapy skill to treat patients who complain of low back pain with stiffness by mobilization with movement therapy. The intention or the goal of this technique is going to be to improve the mobility of the facet joints and thereby help in regaining the mobility. So let's get started. So to perform the technique, the therapist is going to make the patient assume the long sitting position at the end of the couch so that the patient remains stable. Now the therapist is going to use one hand to stabilize the patient from the front, while the other hand, ulnar side border, is going to be placed over the spinous process that we want to mobilize. So let's say we are trying to improve the mobility of the L4, L5 region. So the hand is going to be placed over the L4 spinous process. And now from here, the therapist is going to give a cephalad glide to the L4 region and now is going to ask the patient to perform the forward bending movement. The glide is going to remain maintained and the patient is going to come back, and this has to be performed for around 6 to 10 repetitions and 3 to 5 sets. Now if the pain and stiffness is more towards one side, that is it is the unilateral problem, then the glide can be given to the transverse process rather than the spinous process. So all we have to do is just change the position of the hand from the spinous process to the transverse process and utilize the same hold to give the glide and perform the motion. In those patients who complain of more pain and stiffness during the forward bending activities in standing, the treatment can be given in the same functional position. And for that also, the therapist is going to be behind and towards the side which is affected, and with one hand is going to stabilize the patient from the front so that the hand is over the ASIS, and then is going to give the glide over the desired level in the cephalad direction, and then is going to ask the patient to perform the forward bending motion and come back. Mobilizing the facet joints not only helps in reducing the pain and stiffness, but also helps in improving the discal health by reducing the distortion or tension on them. I sincerely hope that the information shared in this video is going to be helpful for you all. Do keep motivating us with your comments and feedback. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.